doctor who will take you through the detailed benefits of vitamin D.
And I am Dr. Pradeep Kocheeppan here from Apollo Hospital. I am basically an orthopedic surgeon with interest in sports medicine. I am doctor for many of the international teams, especially the hockey, the athletics, who are stationed in Sports Authority of India here. And I take care of basically health of knee joint, shoulder joint, and as orthopedics is a subject that deals with basically primarily bones and joints, and it is advanced into a lot of subspecialties like sports medicines and joint replacement. So one of the major subjects that we come across in modern world or the understanding of certain things, there has been over time a gradual decline in the bone and muscular health of people. Okay, and this has affected the quality of life of people also. So today, my topic would be predominantly to let people understand the importance of vitamin D, which is a vital amine, and its importance, its uses. So why this resurgence and all this thing has come into clinical practice is basically because of one particular factor, that longevity of human life. So what I mean by that is, at independence, an average Indian male's lifespan was around 45 to 50 years, whereas today it has reached up to 68 to 70, and in case of females, gone beyond 75. So longevity has increased. And what has happened associated with that is the amount of physical activity that a man or a woman does has decreased. So the muscles are not stronger and the person is living longer. Now, add to this a compounded issue in the last 20 years, where children and the school systems have all predominantly changed towards more and more education. So, the children who used to play every day for hours and hours have started sitting inside the home with the help of some gadgets, and also lack of playgrounds in various schools are adding to the whole process. One more major issue that we face today is, from an agricultural based society, which used to be in the sun and in the open, it has people have started coming out and working in cities. And in these cities, what is the major issues is they are sitting inside air conditioned organizations. And during the daytime, when there is real uh, sunlight outside, all are working inside, and these working hours and the travel included, practically it becomes that from morning 7 to evening 7 to 8 people are busy and their exposure to sunlight is too poor. So these are the 4 points which needs to be highlighted, and people have to understand these things in perspective, that the longevity has improved, physical loads have decreased, the schooling age, where games used to be the predominantly and the most important things, have also decreased. Along with that, working hours have increased, along with the transit times. So, practically, people are not exposed to sunlight. So, what has become? We learn, as you know, as a society, we keep on learning what is happening to the senior citizens, and the same thing would happen to most of the people if we take it unchecked. So, fractures have become too common in the elderly, and this has been the situation in the Western world, in the developed world, with the people with adequate bone density. The fractures which start at 75s and 85s, we see it at 55s and 65s in India. So fractures have become too common, and we will come back to these points a little later after understanding vitamin D. Now, vitamin D is called as the sunshine vitamin. And why it's called sunshine vitamin? Because body has an excellent way of regulating the production of vitamin D when body gets exposed to sunlight. And in our culture, Surya Namaskaras and all these kind of asanas used to be considered or named in such a fashion that they are done in open air and giving a salutation to the sun. That means that it was expected to be done in open air where there is exposure to sunlight. If people do not get that level of exposure also, the vitamin D production in the body will be limited. Now, big problem with a large amount of vegetarian crowd in the country would be that a vitamin which is more predominantly present in non-vegetarian diet would be difficult to come only through diet. And it is also not recommended in taking in that direction, because that is the reason why vitamin D is called as a sunshine. That you go to sunshine, go into the sunshine, and body will produce adequate amount of vitamin D, and that is a beautiful uh, management that is done by the body itself, and this is called as the homeostatic mechanism. Now we have to consider now vitamin D, what's the role that it does in the body. Now, when a person is born, he has a particular amount of bone density, right? Now, our life has to be divided into three parts: one, two, three. One is the first 35 years. Next is the next 20 years, 35 to 55 to 60. We can keep it as. And the third part is 60 to beyond. So, first 35 years, 35 to 60, and 60 and beyond. This can be put into all male and female. But in female, the second phase stops at menopause, that is 35 to 55, and in males it can extend up to 60. And so these are the three phases of bone mineralization, or what happens to your bone quality. So people have to understand that bones are dynamic structures. Now dynamic means what? Every day there will be some deposition in the bone, and there will be some healing that is happening, is taking away of the bone from the bone. So there is some deposition and some taking away. It is just like when you get a salary, you put it in the bank, and when your month is going on, you take from the bank. And you can understand this very well, that during our working age, we put more than what we take usually, and that's why there is a buildup. So, this buildup of the bone happens in the first 35 years, and it is dependent on how much has been your sunlight exposure, how much has been your physical activity, and how much have you exercised to keep your muscles good, and how good your diet has been. So the first 35 years are the only time in our age where we can have a system where there is more deposition than removal of bone. So this age is the stage at which there's an incremental deposition of bone to get a particular score. Okay, so the most important age to play, most important age to deposit bones is the first 35 years of our life. So this is the age where we have to concentrate, focus on having our children and the young adults and all these to understand the importance of physically being active. Unfortunately, because of the increased amount of competitions, children are unable to play to the extent, and there are of course children playing, but number has reduced, even grounds have reduced. So this has to be understood by parents in perspective, so that children are growing up with adequate bone density. So that's the first 35 years of life where bone deposition is more than removal. Now the second phase of life is between 35 to 55 in a female, that is still menopause, and in males 60 to 65. That's the second phase. In this phase, still deposition happening nicely, but removal is almost equal to the amount of bone deposited. So practically it is what? You are maintaining it. And to maintain a bone, there are no other choices. Have a good physical health, and about dietitian. That is, expose yourself good to sunlight. Diet content of your food should be a good quality, and you should be exercising. Then only you can maintain whatever you have reached. So in the first 35 years, bone density keeps on increasing. It can reach up to 100 mark, some people up to 90, some people up to 70, some people even may not go good. And so in the second phase, whatever you had, you will maintain. And now the dangerous phase is the third phase. And the problem here is the more a person survives, because most diseases are being managed, so people tend to live for a long time, and then these issues come, and that is bone density. In the third phase, the amount of bone removed is more than the amount of bone deposited. Now it is independent of how much calcium, vitamin D, B12 you take. The amount of bone removed will be more than the amount of bone deposited in this phase, and this phase is called as the phase of resorption. And as we become older, the bone resorption increases in the first 5 years after 65. The increase is fast, and then it gradually continues resorbing. So there is going to be a decrease in bone density as every person becomes older. But if your initial score has been good, you don't reach up to a critical level. And a critical level of bone density, so someone who has reached a 90-95% in their first 35 years, even if it reduces, it doesn't reduce beyond a critical level of fragility. But suppose the first 35 years of life has been very inactive. The second 20 years of life has been more indoors and highly deficient in vitamins. Your bone density score has been low to start with. And when this resorption happens, you reach a level of fragility. And that is the greatest problem that we have to understand. And now, in this particular thing, in this particular problem of deposition resorption, what is the role of vitamin D? And that is the most important thing here, which we have to understand in bone deposition. Vitamin D is the most important vitamin to allow calcium to be deposited in the bones. Now, what is calcium? Calcium is a mineral which forms the deposit or the crux of the bone. Okay, the major source of the crystal is calcium there for the strength. But for that to deposit, vitamin D is important. Our diets are usually good in calcium. So calcium, like in milk products, ragi, wheat, rice, and most of the green leafy vegetables which we take along with milk and milk related products. These are very good sources of calcium. So, calcium deficiency because of dietary restrictions are very less unless someone is into extreme amount of food fads in the form of veganism where they have not even added the alternative for this calcium source. So you have to have a very balanced diet in order if you are not eating one particular thing. Otherwise, if your consumption of most products of protein, vitamins, cereals, and milk is adequate, then calcium per se will not be the deficient factor. Then what is the deficient factor that has been found? Over the last 25 or 30 years of research, in modern man, the major issue is vitamin D and not the intake of calcium. Now, vitamin D, because of our lifestyle factors, which I had talked earlier, the four factors that happen because of increased longevity, decreased physical load in our body, the children not playing much, and outdoor activities, and decrease in daytime exposure to sunlight in general people. This is a big issue that we have found that people are deficient in vitamin D, and so vitamin D supplementation is essential. And second, I talked about the various stages of life. So vitamin D supplementation is required in which stage? It required most important in the first 35 years. It needs to be maintained in the second phase, and it also needs to be given in the third phase. But the primarily the most important benefit that will come will be in the first 55 years of life. It will be more preventive only in the life because once the phase of resorption or removal is more, how much ever vitamin D you take, it won't work because there will be at that stage as a requirement of assessment of bone fragility, and then add to these vitamins you have to take medicines also to the bone density. So I hope I have cleared the tract of the whole thing. Now, vitamin D is a pro hormone also. It is not just a vital amine which is required for bone health. It is very important also for muscular strength. And this is known by if suppose somebody is vitamin D deficient, they always will have proximal muscle weakness. So, for example, these muscles, which are mid arm or below, are called as the distal muscles, whereas the part which is above it and the central area, these are all known as the core muscles. And vitamin D deficiency causes core muscle insufficiency. Now, insufficiency means the strength of these muscles are affected. And that is why we see lots and lots of people with back pain, neck pain, tennis elbow, fingers are getting cramped, the toes are paining. When you walk, heel is paining. So many issues that come up because the muscular strength capabilities are less in the core and proximal. So and remember, vitamin D required most important for bone health. It is required for the calcium to go and deposit in the bone, right? And it is the rate limiting one because of the sunlight exposure poor. That is the problem in modern life. But equally important is muscular because if bone has to be deposited, there has to be activity. If person is not active, so someone who is vitamin D deficient will have poor core muscles, and if they go for exercises, also they get a lot of pains and aches. So that's another very big important thing. And now the third most important thing about vitamin D is it also acts all over the body like a hormone. Okay. And the most vital characteristic of vitamin D is to maintain a good immunity in the body. Immunity is required in for many things, right? First, we know about immunity in the sense that, for example, in this coronavirus time, we know that vitamin D helps in maintaining a good immunity. Those who have good vitamin D levels before the infection have lesser chances of becoming seriously ill. Okay, that is an immunity modulating function. Second is immunity helps in preventing or slowing down the growth of cancerous cells, and this has been known in case of vitamin D for the help of prevention or decrease in the incidence of cancer in colon, and to some extent even prostate cancers. Vitamin D has been known to be helpful, right? And even in ladies, the breast cancer also has some association with vitamin D. Now, also, they form some factor in maintenance of good cardiovascular health by maintaining the BP levels well and the heart muscle function good. So, and in old age, we know when a combination of bone thing and all, fall prevention also will require bone density to be or vitamin D to be very good. Now, how does vitamin D when it is gets converted? So when sunlight falls on our skin, body produces a pro vitamin D, and then this vitamin D has to go into first kidneys, first one hydroxylation in liver, and then 25 hydroxylation in kidney, and that's how it becomes a full active form. So body maintains this thing very strictly. So it's not just that you go to sunlight and you have an exposure of 24 hours and you get more and more vitamin D. Body regulates it very well, and that's why it has two more channels to become active. Goes to liver, goes to kidney, and then becomes active form of vitamin D, and it will produce that vitamin D only what is very essential, and it will never produce more because this is a hormonal thing and it cannot make it more. So vitamin D is a fat soluble vitamin and it can tend to accumulate in the body if you consume excessive. So sunlight exposure and getting it is the best way of getting it, but if it is not possible, then you have to consume in a scientifically required amount and dose, which we will come to on later. Okay. Now, what are the problems that come when vitamin D become deficient? In children, nowadays we see it comparatively less, but it leads to a lot of bowing of the legs, and the knees are bent. The It's called rickets or soft bones. And the same thing in adults is called osteomalacia or bones becoming softer. A lot of people come with the presentation of heel pain. That is a very common presentation in adults. Now, remember this particular thing, and this is a very interesting fact that you all must be knowing. In 1968 Mexico Olympics, there was a athlete whose name was Bob Beamon, and when he jumped, he almost broke the previous world record by 50 centimeters of extra jump. And such an extra jump, what could have been the reason? And they studied many factors, and out of them, one of the factors was vitamin D, because this is the high altitude place, 8,000 feet high. The sunlight exposure was good, and he has been training also in these the high sun places, which is near the tropics, and that probably would have led to that is one of the factors which have been considered. So for muscular health, very essential. Now, if someone is vitamin D deficient, have a higher or a poor muscular strength, they have a higher tendency to fall down also. And as we become older, if you fall, there will be a lot of fractures. We see on a daily basis, even during this pandemic times, that fractures in elderly has not reduced at all. In fact, when elderly people do not go out and walk, they don't maintain balance well. A small amount of water here and there and a small slip is enough to break them when they fall. So, very important to understand vitamin D and its role in bone and muscle health. Now, why is vitamin D falling in a country like India? We just discussed on that. So, how much should a person go out? I think I will repeat that point: 20 minutes, 9 to 5, 20% skin exposed, you will get that day's requirement. More, no problem. Body doesn't make more of vitamin D if you stay more. Less, you are not benefited really by being in India. Then there are some stomach issues that people can have, like cystic fibrosis, that is the lung problems, and stomach not able to absorb the food properly. All these issues can be the reason that vitamin D are less. Then the two factors which I want to highlight. One is gallbladder issues. People, if someone is a little obese and more than 40 years, Such people are under high tendency to get gallbladders, and it is very common to have these gallbladder stones and then someone removing the gallbladder. And if the gallbladder gets removed, vitamin D absorption does get affected. So you have to be aware when undergoing a gallbladder surgery to see that you are able to maintain an optimum level of vitamin D. Then similarly, hysterectomy too premature has an extremely dangerous effect on bone and muscular health because of the low hormones of estrogen and progesterone that keeps the bone health good in ladies. So too early removal of uh, uterus is a very big risk factor for having poor bone health in the old age. Then overweight, obesity. Obesity comes with lack of activity, and when lack of activity, no bone can be strong in a person who doesn't walk or exercise and keep. And then we saw liver and kidneys are required for activating the vitamin D, which is produced by the skin or the diet, and that, if affected, also can cause. And also remember the various food fads. Just because some of the stars are on a vegan diet, they are getting a vegan diet which is extremely balanced by expert nutritionist. But if some people try to do it by themselves, they may end up in essential vitamin insufficiency. How do we check? We have to check the blood levels to know what is the level of vitamin D. There are various tests. You can just check vitamin D3 levels, or you can check the active form 125 dihydroxycholic acid also. So the take home points: sunlight exposure is very essential. Very important to be active right from childhood. Equally important as education of books would be education in outdoor environment and children going out for activity. When the age between 30 to 60, maintain your activity level so that the muscle doesn't reduce. After 40 years, every human being will have decrease in the muscle mass if they do not do muscle strengthening. Nothing remains constant. So these are the take home points that people have to get exposed to sunlight, and there has to be good exposure to physical activities also, including weight training as the age goes in a sensible fashion and not overdoing them. So we see a lot of problems. People put a lot of sunscreen and go around and want vitamin D. They get sunlight through the glass of the house, windows. That doesn't help. So it has to be direct skin exposure. And because of the pollution levels, also we are feeling that 20 minutes may not be enough. So having it at 30 minutes would be more recommended. In one of the recommendation that may come very soon because of the pollution levels, the amount of the vitamin D absorption or the production that happens gets hampered by the skin. So again, vitamin D most important for optimum bone health, and the story starts when a person is born. First 35 years most critical to have an optimized bone density, because that is the only age where bone deposition is more than resorption. The next 20 years maintain whatever you have, and the next, don't allow the deterioration to come, and if already low, start medications. Then strengthen muscles. Vitamin D itself is important for keeping the core muscles good, but if vitamin D levels are good, the strength of muscles are much better. Example given is always Bob Beeman. Oral health or dental hygiene, again it's a bone, or it is a dentine, calcium based things. Oral health, it helps in the immune system to a very large extent. And one point which I need to make is tuberculosis is so common in India, and one of the major factors that we should know is that anyone who stays in a full indoor environment is under a high risk of getting activation of the latent tuberculosis, which is there in every possible Indian. So, if that should not come, vitamin D is one of the most critical of vitamins. You should have your adequate doses of vitamin D, especially sunlight exposure. So I remember a time when I was in when I studied my MBBS during our preventive and social medicine, we were made sometimes to go into the trains and then speak to people that get exposed to sunlight so that vitamin D doesn't become deficient. And so when you are traveling in crowded places, your chance of activating the latent tuberculosis bacteria is not much. So very important. It also tends to have a diabetes prevention role, and it also has a role in cardiovascular health. But remember, in diabetes prevention and in cardiovascular health, these are not the major factors. These are a contributor only. They are not the major. But in case of bones, it's a major factor. And vitamin K. Now, vitamin K is often added with vitamin D when you are giving it, is because vitamin K is again the out of the four A, D, E, and K. These are the four fat soluble vitamins. Vitamin K is required in coagulation cascade, means blood clotting. So I was talking to you about vitamin D and calcium when taken excessively can lead to vessel calcification. So that's why people go away from not putting calcium in it, but add vitamin K to it so that the vessels don't calcify off and you get the optimized benefit of vitamin D in a correct way. So vitamin K activates the protein and the osteocalcin, which integrates calcium into bone and also prevents this calcium deposition into these vessels. So that's a combo effect because of vitamin D present. Thank you.
Thank you so much, doctor, for sharing your insights on vitamin D. Clearly, Nutrolite Vitamin D Plus is a complete package, with vitamin D3 having 1900 IU, vitamin K2, and the patent combination of licorice and quercetin as a daily supplement for the adults with weakened bones to support your bone health and immunity. So stay tuned for this exciting launch